important factors determining the heat production, or what is called thermogenesis. We have covered this topic in the thermoregulation by the hypothalamus. Anyway, for your benefit, I revise you. This is a brief note. So now, what are the various important factors that determine the heat production or thermogenesis? One, sievering. Sievering that produce sievering means this is an involuntary activity. This is what happens, the muscles are activated and that produces a large amount of energy. That's one part that increases the muscle activity. The second, it's a sort of an involuntary phenomenon. Sievering is not voluntary, so it's involuntary. So non-sievering thermogenesis, because this is another thing. There is a brown adipose tissue. When by the increased sympathetic activity, brown adipose tissue is activated, that produces a greater heat or greater calories. So that is by activating a non-sievering thermogenesis by increasing the activity of the brown adipose tissue. In the mitochondria, I mentioned about it. So that means the mitochondria's functions, I mentioned, it is the increased calorie genesis. So this is where they have a large number of mitochondria, and that would increase the calorie genesis. And it increases the hunger. It makes the appetite. It increases the hunger and appetite. So that increases the food intake. The increased food intake, actually the protein component of the food will have a specific dynamic action. That means they will produce extra calories. They will produce extra calories than what exactly the protein molecules are producing. So this is called a specific dynamic action of a food, especially protein. So that means by hunger and increased food intake. So then there will be increased voluntary activity. So that means you are trying to move and you are stepping your moving your limbs or trying to do some activities. So that increase the voluntary activity. The voluntary activity increases the heat production. There is what is called a piloerection. The hairs become stiff, and that's what is called a horripilation. Horripilation, they become stiff, and this is because of the increased sympathetic activity. The horripilation or piloerection, because there are smooth muscles there, they are activated and they produce the heat. At the same time, when they produce the heat, they will have a shield because they will not allow the air is getting trapped in this thing, and they will try to prevent the interface. So that means there are other components. So there is a increased sympathetic activation. That is a norepinephrine and epinephrine levels increase. Further, there will be a decreased heat loss mechanism. So the heat loss mechanisms are not activated. They are not activated. They will not be, there won't be sweating. Suppose simultaneously sweating happens, then whatever is done is gone. And other things will not happen. So that means they will prevent all those heat loss mechanisms. There is a vasoconstriction because of norepinephrine and epinephrine, so that the blood is the outer the temperature is not taken by radiation and convections. And the person is curled up. He's trying to prevent the surface area. Curled up, prevent the surface area so that he cannot gather more heat. And there are behavioral changes, or that means you want to have a good clothing, and you want to have the food, nice food, and a warm food or a hot food, and then you want to go for an activity, you want to go for a trekking and the sports activity, and your posture, all those things. And even when you go to the bed, you need a blanket or a heating devices and all those things. These are the behavioral things. So I have mentioned 10 here. So important factors I would mention: one, sievering, non-sievering thermogenesis; specific dynamic action, third; voluntary activity 4th, the piloerection 5, and sympathetic activity. At least you try to remember these 6, and other things you try to make it. I have made 10 points for you. Okay,